It often starts quietly, a little swelling in one leg, maybe some warmth around the calf, and a tight feeling when you walk. You might think it's just fatigue, or maybe you sat too long. But sometimes that swelling isn't harmless. It's the warning sign of something far more serious, a blood clot. After 60, our circulation naturally slows. The veins in our legs work harder to push blood upward against gravity. If blood begins to move sluggishly because of long sitting, certain medications, or health conditions, it can start to clump together inside a deep vein. This is called Deep Vein Thrombosis, or DVT. And when it happens, time matters. A clot in the leg isn't just a leg problem. If that clot breaks loose, it can travel to the lungs and block blood flow, a life-threatening condition known as a pulmonary embolism. The frightening part: it can happen with little warning. What seems like a bit of swelling could become an emergency within hours. That's why learning the difference between normal swelling and clot-related swelling is so important. Most mild leg swelling is even on both sides and improves when you elevate your legs or reduce salt intake. But clot-related swelling usually appears suddenly, affects only one leg, and often comes with pain, warmth, or redness in the calf. In this video, we'll break down what causes blood clots after 60, how to recognize the early red flags, and when to seek immediate help. You'll learn how simple daily habits like staying hydrated, moving every hour, and knowing the warning signs can literally save your life. So if you've ever noticed swelling that doesn't feel quite right, stay with me, because understanding what your body is trying to tell you could be the most important lesson of all. To understand why blood clots are so dangerous, it helps to know what's happening inside your veins. Your body's blood moves through a network of vessels. Arteries carry oxygen-rich blood away from the heart, while veins bring it back. Inside, the veins are tiny one-way valves that open and close with each heartbeat, keeping blood flowing upward against gravity. After 60, those valves can weaken. Long hours of sitting, certain medications, or health conditions like varicose veins, obesity, or heart disease can make blood flow sluggish. When blood slows too much, its natural tendency to clot becomes stronger. Small clumps of platelets can stick together along the vein wall, forming a blockage. This is deep vein thrombosis, or DVT. DVTs usually develop in the deep veins of the calf or thigh, though they can occur elsewhere. The clot itself might not be visible, but the leg may feel swollen, warm, or tender to the touch. Some people describe it as a dull, pulling ache that worsens when standing or walking. Others notice tightness, heaviness, or red or bluish skin on the affected leg. The real danger comes when a clot, or even a small piece of it, breaks loose and travels through the bloodstream. If it reaches the lungs, it can block blood flow, causing what's known as a pulmonary embolism, or PE. This can lead to sudden shortness of breath, chest pain, rapid heartbeat, and even collapse. It's a medical emergency that requires immediate treatment. That's why recognizing the early signs of DVT matters so much. It's not just discomfort, it's your body sending a warning signal. When treated early, DVT is highly manageable. But if ignored, it can become life-threatening. In the next section, we'll go over the warning signs and red flags to watch for, the subtle clues that can help you tell the difference between everyday leg swelling and swelling that could mean a dangerous clot. When it comes to blood clots, timing is everything. The earlier you recognize the signs, the easier it is to prevent a medical emergency. The challenge is that early symptoms can be subtle and often mistaken for simple fatigue, muscle cramps, or even arthritis. But your body usually gives clear signals if you know what to look for. 1. Sudden swelling in one leg. The most common sign of a deep vein thrombosis is swelling that affects only one leg, usually the calf or thigh. Unlike mild, even swelling that comes from sitting too long or salt intake, DVT swelling is often dramatic and appears suddenly. Your leg might feel tight, heavy, or larger than usual, and the swelling doesn't go down when you elevate it. 2. Calf pain or tenderness. Another key symptom is a deep, aching pain or tenderness in the calf or behind the knee. The pain often worsens when you stand, walk, or flex your foot upward. Many people describe it as feeling like a muscle cramp that doesn't go away. If that discomfort appears in one leg and is accompanied by swelling or warmth, it's time to pay attention. 3. Warmth and redness. Run your hand over both calves. If one feels noticeably warmer than the other, or if the skin looks red or discolored, it can be a sign that a clot is blocking blood flow and causing inflammation in the vein. The warmth may feel subtle at first, but it usually persists even at rest. 4. Visible vein changes. In some cases, you might notice veins near the skin becoming more visible or slightly raised. They can appear bluish or darker than normal, often accompanied by a heavy or throbbing sensation. This happens when blood tries to find alternate routes around a blockage. 5. Shortness of breath or chest pain. If you ever develop swelling in one leg and suddenly feel short of breath, dizzy, or experience chest pain, seek emergency help immediately. That combination can indicate that part of a clot has broken free and traveled to your lungs, causing a pulmonary embolism. This is life-threatening and must be treated right away. When it comes to blood clots, the line between concern and emergency can be very thin. Some swelling may simply mean tired legs, but when that swelling is caused by a deep vein thrombosis, DVT, acting fast can make the difference between recovery and crisis. The key is to know exactly when to stop watching and start acting. If you notice sudden swelling in just one leg, especially when it's paired with pain, warmth, or redness, treat it as urgent. Don't wait to see if it improves overnight. Contact your doctor immediately or go to an urgent care center. A quick ultrasound scan can detect a clot long before it becomes dangerous, and treatment can begin right away. But there are moments when waiting is not an option, when you must call emergency services or head straight to the hospital. Here's what those red flag symptoms look like. Sudden shortness of breath, feeling like you can't get enough air. Sharp chest pain that worsens when you breathe in. Rapid heartbeat, dizziness, or lightheadedness. Coughing up blood, even a small amount. These symptoms may mean a clot has traveled from your leg to your lungs, causing a pulmonary embolism, PE. A PE blocks blood flow and prevents oxygen from reaching your body. It can be fatal if untreated, but with immediate medical care, it's highly survivable. At the hospital, doctors typically use imaging tests like a Doppler ultrasound for the legs or a CT scan for the lungs to confirm the diagnosis. Treatment often starts with blood-thinning medication, which prevents the clot from growing and stops new ones from forming. In some severe cases, clot-dissolving drugs or minor surgical procedures are needed to restore normal circulation. The good news is that, when caught early, DVT and PE are both highly treatable. Many people make a full recovery and return to normal life with some medication and a few lifestyle adjustments. But the danger comes from ignoring early signs or assuming the swelling will simply go away. If you're over 60, recovering from surgery, traveling long distances, or spending long hours sitting, your risk is higher. That makes awareness your best protection. The moment swelling feels different, firmer, painful, one-sided, or warm, take it seriously. It's far better to check and find nothing than to wait and face a medical emergency. Next, we'll explore how to prevent blood clots before they form the everyday habits and choices that keep your circulation strong and your legs safe. While deep vein thrombosis sounds frightening, the encouraging truth is that most blood clots can be prevented. Prevention begins with simple, consistent habits that keep blood flowing freely through your legs. These habits don't require special equipment, just awareness and small daily actions that add up to major protection. 1. Move regularly. Movement is the most powerful defense. When you walk, flex your ankles, or even wiggle your toes, your leg muscles act like pumps, helping veins push blood back to the heart. If you sit for long periods, whether at a desk, in front of the TV, or during travel, aim to move every 30 to 60 minutes. Stand up, stretch, or take a brief walk around the room. Even rotating your ankles in circles or gently tapping your heels can help circulation. 2. Elevate your legs daily. Give your veins a break from gravity. Elevating your legs above heart level for 10-15 minutes each day helps fluid drain naturally. Doing this while reading or watching TV can reduce swelling and relieve pressure that builds over the day. 3. Stay hydrated. Dehydration thickens the blood, making it more likely to clot. Many older adults drink less water without realizing it, especially in cooler months. Keep water nearby and sip throughout the day. Herbal teas, clear soups, and fruits with high water content like oranges or watermelon also support healthy hydration. 4. Wear the right clothing. Avoid tight waistbands, elastic socks that leave deep marks, or shoes that restrict circulation. If your doctor recommends compression stockings, wear them as instructed. They're designed to apply gentle, even pressure that improves blood flow. 5. Watch your medications and health conditions. Certain medications like hormone therapy, birth control, or cancer treatments can increase clotting risk. Always discuss new prescriptions with your doctor, especially if you've had swelling or circulation issues in the past. If you have diabetes, heart disease, or varicose veins, regular checkups are essential to catch potential problems early.